Ginger might be the most trusted herb in your kitchen and the most misunderstood. People have used it for thousands of years for nausea, for digestion, for pain. And here's the honest part. Modern science backs some of that beautifully, and some of it barely at all. So today, let's do something simple but rare. Separate what tradition says from what the evidence actually shows. One claim at a time. Respect tradition, verify with evidence. Quick note first. This is education, not medical advice. Ginger is powerful enough to interact with medications. So if you're pregnant, nursing, taking medication, or heading into surgery, talk with a qualified healthcare provider before adding it. So, what is ginger really? Botanically, it's Zingiber officinale, and here's a fun correction. The part we use isn't a root at all. It's a rhizome, an underground stem, a close cousin of turmeric and cardamom native to tropical Asia. And people have prized it for a very long time. In medieval Europe, a single pound of ginger could cost about the same as a whole sheep. Now here's the piece that unlocks everything else. What's actually in it? Fresh ginger is rich in compounds called gingerols. When you dry or heat ginger, those gingerols transform into shogaols. Same plant, different chemistry, depending on the form. Hold on to that, because it's going to matter. And how does it work in the body? In plain English, ginger seems to ease nausea by calming a serotonin signal and by helping the stomach empty. It may also dampen certain inflammation signals. But I want to be careful here, and this is a rule for the whole episode. A mechanism is not a cure. Knowing how something could work is not the same as proving it does work in people. That proof only comes from clinical evidence. So, let's go get it. Every claim today gets a rating on our confidence scale. 1 to 5 stars, based on how strong the human evidence really is. 5 stars, rock solid. 1 star, barely a whisper. Let's start with ginger's strongest card. If ginger is proven for anything, it's nausea. And the best evidence is for the nausea of early pregnancy. Multiple reviews find that about a gram a day of ginger reduces pregnancy-related nausea compared to placebo, roughly on par with vitamin B6. That's a genuine 4-star result. But, and this matters, pregnancy is exactly where the guidance splits. So here's the honest picture. Ginger and pregnancy, the guidance conflicts. The US NCCIH says ginger may be safe and may help morning sickness. Memorial Sloan Kettering says avoid ginger supplements. In pregnancy, citing limited human safety data. They disagree, so please don't self-prescribe. Talk to your prenatal provider. Ginger also shows up for nausea after surgery. Taking at least a gram before an operation appears to reduce post-op nausea and vomiting. A solid 3 stars, though health agencies still call it not fully settled. And what about chemotherapy nausea? Here I need to be very precise. Some studies suggest ginger, added alongside standard anti-nausea medicine, may help, but major cancer care guidelines do not currently recommend ginger as a standard treatment. Ginger and chemo nausea, adjunct only. Ginger is at most an add-on to discuss with your oncology team. It does not replace prescribed anti-nausea medication. Now for the claim everyone thinks is settled, motion sickness. This is the perfect place to show you how we read evidence. What does tradition and a lot of marketing say? Ginger prevents motion sickness. What does the science actually show? It's mixed and weak. When researchers tested it in careful controlled conditions, ginger often didn't reliably prevent motion sickness at all. And what's still uncertain? The trials are small, old, and inconsistent. So this one's about 2 stars, a popular belief that runs well ahead of the proof. Popularity isn't evidence. Let's talk pain. For knee osteoarthritis, ginger gives a modest reduction in pain in pooled trials, real but small, and the research quality is often weak. It's also worth knowing more people quit ginger than placebo because of stomach upset. So, a modest helper, 3 stars, not a replacement for your treatment. You'll also hear ginger called a powerful anti-inflammatory. Here's the careful truth. It can lower some inflammation markers in the blood, though not all of them. But remember our rule, those are lab markers, not proof it treats an inflammatory disease. Promising signal, not a finished story. One quick bonus, because the evidence is actually decent, menstrual cramps. Taken in the first days of a period, ginger reduced period pain versus placebo, in some studies, comparably to common painkillers. A solid 3 stars for a use that doesn't get enough attention. And muscle soreness after exercise, early days. A few small studies hint at slightly less soreness, but it's preliminary. Call it 2 stars. What about plain old digestion? The reason many people reach for ginger tea. Ginger does speed up how fast your stomach empties. But here's the twist. In studies on indigestion, that faster emptying didn't actually make people feel better, and for some, ginger can worsen heartburn and reflux. Mechanism, yes. Symptom cure, not proven. 2 stars. Finally, the trendy claims. Blood sugar and weight. Some studies hint ginger might nudge blood sugar down or help shed a little weight, but the findings are inconsistent. The effects are modest, and the reviews flat out disagree with each other. So let me be direct. Ginger is not a treatment for diabetes or for weight loss. Interesting to watch, not something to rely on. So how do you actually use it? Remember gingerols and shogaols? Form matters. Fresh ginger, a cup of tea, dried powder, capsules, a standardized extract. They're not interchangeable. A mug of ginger tea is not the same dose as a concentrated capsule. And here's why that's not just a technicality. Fresh ginger is gentle and gingerol rich. Great for cooking or tea, but hard to dose precisely. Dry that same root into powder, and you concentrate the shogaols we talked about. So a spoonful can pack more punch than a whole chunk of fresh root. Capsules and standardized extracts go further still. They're built to deliver a consistent, measured amount, which is exactly what most clinical trials test. So when you hear ginger reduces nausea, that usually means a specific extract at a specific dose, not just eating ginger. As a rough guide, studies use somewhere around 0.5 gram to 3 grams of dried ginger a day, and about 1 gram a day for nausea. Honestly, the ideal dose still isn't nailed down. If anything, ginger is often underdosed. Food amounts are gentle. Concentrated supplements are where you pay attention. So what does this mean for you practically? For a little stomach settling, fresh ginger or a simple tea is usually plenty. That's the gentle food end of the spectrum. Chasing one of today's stronger findings, like pregnancy nausea, a measured capsule or standardized extract makes more sense because that's what the studies actually tested. Either way, the same 2 things that shape the benefit, form and dose, also shape the risk. More concentrated isn't automatically better, it's just more. And that's worth sitting with for a moment. Early on, we talked about how ginger might work in the body, but a mechanism is a hypothesis, not a guarantee. Even where evidence is genuinely strong, like nausea, or modestly promising, like joint pain, ginger remains a modest helper, not a cure. And that brings us to safety, the part you don't skip. Ginger is safe for most people in food amounts, but in supplement doses, 3 cautions really matter. Blood thinners and surgery. If you take anticoagulants or antiplatelet drugs, warfarin, aspirin, clopidogrel, or newer blood thinners. Ginger may add to your bleeding risk. A fatal bleed has actually been reported in someone combining ginger with the blood thinner dabigatran. Stop ginger supplements about 1 to 2 weeks before any surgery. Talk to your provider. Diabetes medication. Ginger may add to the blood sugar lowering effect of insulin or diabetes drugs. Monitor and check with your provider. Gallstones. If you have gallstones, avoid ginger supplements. Ginger increases the flow of bile. And as we said, in pregnancy, the guidance conflicts, so ask your prenatal provider. None of this is meant to scare you. It's respect. Know these, and you can use ginger wisely. So here's the honest scorecard. Ginger's best proven use by far is nausea, especially in pregnancy. It's a modest helper for knee pain, period cramps, and some inflammation markers. And for motion sickness, weight, and blood sugar, popular, but the evidence just isn't there yet. Which leaves us with the one idea to carry out of here. Ginger is a tool, not magic. It's genuinely useful. It's low risk in the amounts you'd cook with. And this is the part that makes it trustworthy. It's honest about its limits. Respect the tradition, verify with the evidence, and you'll always know exactly what you're reaching for. If that's the kind of grounded, honest herbalism you've been looking for, subscribe and grow with us. And next time, we meet ginger's famous golden cousin, turmeric. Everyone calls it a miracle anti-inflammatory, but does the evidence agree? Respect tradition, verify with evidence. See you next time.